Hi, Dr. James Petrick. Let's talk about scoliosis. I would not be a chiropractor right now if I didn't have scoliosis. I would not be doing the type of work that I do right now if it wasn't for the help that I got with my scoliosis. I see what we do here, even though I do my work from the top of the neck, I see it as a full spine adjustment. If we can accomplish the hip imbalance, the leg length imbalance, the lower back, the hip area range of motion problem, all by doing just one thing, well then that means that the imbalance down here, the imbalance, the short leg, all of that was a compensation to up here. So we go for it all here. And I do that because, once again, I used to be walking around like this. This is actually my x-ray right here. And it's so important to know exactly all the different nuances, the shapes of the vertebrae. I'll flash up another one of my x-rays. What I want you to notice is right over here on the right-hand side. Do you notice how this joint is high up along the right-hand side? And on my plastic model here, this is the back of the skull. What we're looking at there is this little joint right here is higher up on the right-hand side than this side. Not because the head is tilted, it's just anatomically like that, and I feel that that's because of some trauma that I've had in sports. Now, we don't adjust this vertebra and that vertebra and this vertebra and that vertebra. We try to have a full spine, full body effect by only touching C1. And the reason is because of the neurology in the brainstem, the sidemost part, these two little wires right there, and your brainstem is about as thick as the tip of the pinky right there. When the atlas, top bone in the spine, misaligns to the side, it can put pressure on those critical nerve pathways. And then as a compensation, because you can't walk around like this, what can happen is one leg can draw short, the hip can drop down on one side. And so we have to look for the cause of that global imbalance. This isn't to suggest that if a person has scoliosis that we're going to make their curves like this. But we can certainly slow down the degenerative changes by addressing the system, the area of the body that is in charge of the tone of the muscles that go all the way down your entire spinal column. Just like how you tune a guitar from the top of the neck, you don't do anything to the string down here, you deal straight with the source, and that's how we help people get out of pain who have scoliosis.